When you picture a hospital, you probably think of a place of healing, right? A safe haven for the sick. But what if I told you that for the millions of people who work there, hospitals can be one of the most dangerous workplaces around? Let's pull back the curtain and take a look at the hidden dangers lurking in these very places of healing. So let me ask you this. When you think of danger in a hospital, who do you see? Maybe a surgeon in the middle of a really complex, high-stakes operation? Or an ER doctor handling a major trauma? Well, the reality might surprise you. Often, the biggest risks aren't the dramatic ones. They're the invisible, everyday dangers faced by nurses, technicians, and even the housekeeping staff. We're talking about constant physical strain, exposure to diseases, and just immense psychological pressure, day in and day out. And this really gets to the heart of the paradox of these places. They are built for healing, but for the people working inside them, they're absolutely packed with hazards. It's a tale of two realities, really. For patients, hospitals are these incredibly controlled, sterile environments designed for recovery. But for employees, they're navigating a minefield of biological, physical, and even psychological risks. From bloodborne pathogens and heavy lifting to just the sheer stress of the job, the dangers are everywhere, all the time. So what happens when these risks are overlooked? Well, the cost of neglect is just staggering, and it's not just a cost for the staff, it hits the entire healthcare system. Get a load of this. The physical toll is immense. Up to 85% of clinical staff suffer from musculoskeletal pain. Just let that sink in. The very people we rely on to lift us and care for us are literally breaking their own bodies to do it. And the risk of infection, it's just as bad. In India, it's estimated that as many as 1 in every 3 healthcare workers gets a needle stick injury each year. Every single year. That is a terrifyingly high chance of being exposed to some really serious diseases. And here's the crucial thing. These aren't just isolated incidents. They create this massive ripple effect. Experienced staff burn out and leave. Hospitals get hit with fines, and what's the bottom line? Patient care suffers. It erodes the trust we all place in these essential institutions. Okay, so that's the problem. But the good news is, it doesn't have to be this way. There is a blueprint for safety out there, a framework specifically designed to protect these essential workers. I absolutely love this analogy. Think of all those regulations not as bureaucratic red tape, but as a hospital's immune system. They're the proactive defenses that are meant to spot threats and protect the entire organism, the workforce, from getting sick or injured. And this immune system has layers. You've got big foundational things like the Occupational Safety Code, which sets the groundwork for a safe workplace. Then you have super specific rules like the biomedical waste rules, which deal with daily hazards like needles. And then the Clinical Establishments Act makes sure the whole building meets safety standards. They all work together to create the shield of protection. Because at the end of the day, when you strip it all away, all these rules and procedures come back to one simple, powerful idea: protecting the people who are the absolute backbone of our healthcare system. All right, so having a blueprint is one thing, but how do you turn that piece of paper into a real, safe building? Let's look at how hospitals are actually putting safety into practice on the ground. It all starts with a health checkup. For the hospital itself, it's called an OHS audit. And this isn't just a quick walkthrough. It's a deep dive into everything, from infection control and waste management to ergonomics, emergency prep, and of course, staff training. The whole shebang. And the great thing is, a hospital doesn't have to spend a fortune overnight to make a difference. You can start with simple, low-cost, quick wins, like making sure sharp spins are always right there where you need them. Those small changes can build momentum for the bigger investments that have a huge impact, like safety-engineered devices or high-tech tracking systems. And we can actually see the path forward by looking at the leading hospitals. They treat safety as a continuous cycle, not a one-and-done project. You set clear policies. You create a system where people feel safe reporting incidents. You offer health services to your own team. And then you constantly monitor everything to see how you can get even better. So why should any of this matter to you if you don't work in a hospital? Well, here's why. The safety of healthcare workers is directly, and I mean directly, tied to the safety of every single patient that walks through the doors. I mean, think about it. A nurse who isn't worried about injuring their back, or a technician who feels totally protected from infection, that's a caregiver who can be 100% focused on their patient, on you. When you get right down to it, staff safety and patient safety truly are two sides of the very same coin. And that leaves us with one final big question to think about. We measure our healthcare systems on so many things: patient outcomes, costs, new technology. But maybe the most important measure of all is how well we protect the very people who have dedicated their lives to healing us. Is their safety the true measure of a healthy system? It's something to think about.